Welcome back to our C-TAC Summit programming. I'm Dr. Tamron Gray from Harvard Medical School, your host for today's program. I'm honored to be a part of the 2021 C-TAC Summit based on the invitation from an important C-TAC sponsor, the Cambia Health Foundation. It has been a pleasure to be selected as part of the Sojourn Scholars Program. So I want to take a little time to share a little bit about myself. I earned both my undergraduate and master's degrees from the University of North Carolina at Chapel Hill. My MPH from the Harvard T.H. Chan School of Public Health with a focus on clinical and social epidemiology, and my PhD from Johns Hopkins University. As a Sojourn Scholar, I recognize that there is currently no standard way to support family caregivers at the time of hospital discharge to when patients move across different care settings, whether it be back home, the skilled nursing rehab, or independent living. People with advanced illness and their families still face challenges like fragmented siloed systems. This is one thing that C-TAC has really noted widely throughout. And this often results in unnecessary suffering and patients and families not really getting the care that they want, where they want. Family members are a fundamental part of patient care and outcomes. In recognition of this concept, the Caregiver Advise, Record, and Enable Act, also known as the CARE Act, was recently passed and requires that hospitals must inform and involve caregivers about and prepare them for discharge. Yet no data exists on its impact or implementation. So for my Cambia project, I'm incorporating multiple research methods, including data science, to really evaluate the implementation and impact of this CARE Act within a large regional health system. And the goal is to really understand the association between documenting and involving family members in care and how it's related to palliative care uptake and other health outcomes for patients with serious illness. And overall, my goal as a research scholar is to understand how family members are incorporated into care and whether that inclusion is being extended into the community when patients are discharged. And as we did for the first roundtable discussion, we're going to begin this exploration of advanced care planning, policy, and practice with the perspective of a recognized leader in community-based healthcare. A person who witnesses the importance of advanced care directives within the continuum of serious illness care on a daily basis. The Reverend Cynthia Carter Perilliat is the Executive Director of the Alameda County Care Alliance based in Oakland, California.
So it's a pleasure actually for me to talk about the Alameda County Care Alliance collaboration and our approach to what we call holistic care as it relates to community support and those that are dealing with advanced illness and their precious caregivers. And so as we talk about dissemination of our model and spreading it across the country, we'll refer to our organization as the Care Alliance. But our actual intervention is the ACCA Advanced Illness Care Program. So this 5 cornerstone holistic approach to care is really all about meeting the needs of individuals, not only as it relates to advanced care planning, but really looking at their situation, their life, their circumstance from a perspective that embraces them as a whole person. So for example, this approach cornerstones in spiritual care, but we really try to, in the spiritual cornerstone, really delve deeply into the values of individuals. And I have to tell you, that is this cornerstone that we really get to know people and people really feel heard. And so the second cornerstone is that of health needs. And so with health needs, we are, of course, a non-medical model to care. But what we really focus on is trying to identify, for instance, as an example, have you received your medication list? Do you have that accessible to you? Are you prepared for your physician visit or your visit with your clinician? One of our tools that we've developed is a clinician visit tool, which is really important. Our navigators, these important trusted individuals on our team. And the heart of our program, really through motivational interviewing and storytelling and story listening, really hear and understand what's important to that individual so that we really do have a personalized program that meets the needs of the individual. Of course, one of our third cornerstones is around advanced care planning. And this is really significant. Our health system partners absolutely love our 5 cornerstone approach, but have a deep appreciation for the goal setting techniques that we engage in, not only around advanced care planning, but all of our cornerstones. But even in this environment, in the COVID environment that we find ourselves, people are still really opening up through, again, this 5 cornerstone approach. So advanced care planning is really important, helping them to make determination about who that healthcare agent would be for them if they can't speak for themselves. But I also have to tell you that through some important funding that we received through the Stupsky Foundation, we have been really able to develop our own care planning workbook. But I also want to talk about the other 2 cornerstones in our approach. One is social needs. And of course, when we're talking about marginalized communities, low income communities, really people don't necessarily have access to all the resources that many times our communities have, but people that are dealing with advanced illness, caregiver needs, it's really difficult to uncover and identify those social organizations, such as transportation to the doctor's office, transportation to the grocery store, or wherever they need to be connected to in the community, but also issues like socialization. But last but not least of those 5 cornerstones are our caregiving needs. And so we enroll caregivers such as we do with persons needing care, but our caregivers are also go through this needs assessment process that we have as it relates to really understanding holistically what those needs and concerns are for that caregiver. So now you've heard the 5 cornerstone approach to our holistic approach to care, but specific to advanced care planning. I want to go back to advanced care planning because really the approach that we find is significantly important and has contributed to higher than 55% completion rate in predominantly African-American community focus work is the fact that we do have these thoroughly trained care navigators, an extension, if you will, of the healthcare system, an extension that is embedded in community. So there is a light at the end of the tunnel. Advanced care planning can be a process where people literally feel empowered. And that's really what this is about, isn't it? How do we empower the community to know that, number one, their voice is important, that they're being heard, and that their needs can be met when it is absolutely most important. Thank you.